Hi, my name is Libbie Tacia, and I'm going to be doing my final biotechnology project all about precision medicine. So in my presentation, I'll be covering an introduction to what it is, the history and development, intended uses and benefits, ethical concerns, challenges, controversies, future prospects, a conclusion, and lots of images along the way. So for the introduction, what it is. Precision medicine is a personalized approach to healthcare treatment based on individuals' factors such as genetic makeup, lifestyle, and environment. There's no exact process or specific science as it looks different for everyone and every disease, but it starts with using data from people's omics, which is genetics, epigenetics, proteomics, to create sequencing technologies that allow for a single test that improves diagnostic information. This image over here shows the main components of making medicine personalized, which involves diagnosing, preventing, and selecting treatments. For the history and development, it's been developing for about 100 years, but a lot has been going on in recent years. There's no clear start date or founder, which can be seen in this image because it's really just been a shift of one-size-all-fits medicine to group medicine to now precision personalized medicine. There have been many initiatives and platforms that have been launched in recent years that have just poured funding into precision medicine, which I'll get into on the next slide. And it's really just developed from trying to figure out what's best for each patient to actually having advanced testing to decide that, such as liquid biopsies, which I'll talk about in a little bit, pharmacogenomics, which allows for drug testing to see how someone will react to a drug before they actually have to take it. So there's lots of new tools in precision medicine that are being used. And it's also developed from just treatment to now risk prevention is a huge thing. So finding out who's at risk for certain diseases, cancers before they can get it. So here's a little timeline of the development and history. In 1976, the first genomic sequencing was performed, and this was huge for the future of precision medicine because it proved that scientists can read DNA and they can find specific mutations in DNA. In 2005, a genome-wide assessment study on age-related muscular degeneration was done. And this just showed that this helped them to find the mutation in DNA that caused AMD and allowed for specific treatments to be done from there. In 2015, President Obama launched a huge precision medicine initiative, which just poured funding into precision medicine. And it took precision medicine from just being an idea to really being the future of precision medicine. Similarly, in 2016, the American Heart Association launched their own precision medicine platform that's filled with data, as well as an institute to fund careers and training in this field. Now, 2023 to now, specific technologies have been emerging, such as liquid biopsies, which is a blood test to find biomarkers instead of having to go through a whole surgery. Additionally, technologies like CRISPR, single gene sequencing, and digital health monitoring have been emerging as well. This graph shows the number of registered precision medicine trials per year. It really skyrocketed in 2021, and now they've been dipping a little bit as these trials turn into real treatments. The uses and benefits. The main benefit is just that it's super versatile and it can be used for anyone living any lifestyle with any environmental factors. And it uses their genetic information, not only for treatments, but for a better understanding of how diseases occur and an improved overall approach to treating and preventing. It is mostly for cancer and rare diseases, but it's en route to being implemented in new fields. There's actually an example in one of my sources from the CDC of a man named Juan who had heart disease. He was very forgetful. He'd always forget to take his pills, never had his phone on him to set a reminder. But because of precision medicine, they could prescribe him a digital health monitoring watch that set off an alarm every day when he needed to take his pills, and he could live a healthier lifestyle because of that. Going more into a specific use of precision medicine, the National Heart, Lung, and Blood Institute launched a 3-day workshop for scientists, doctors, researchers to be able to identify people with high risk for CVD. They focused on data science, implementation science, and analytical science. And throughout this workshop, people were trained, ideas were funded, and tools were created. And they realized that precision medicine is more than just cancer diseases, but it can be used for CVD risk prevention. The other really big thing with CVD is epigenetics play a huge role. Your environment, lifestyle factors, family history play a large role in if you're high risk for heart disease. Now, the ethical concerns. There's kind of a lot here, especially because of patient privacy, security, and confidentiality. Precision medicine is backed up by just a web of big data, and that's how they figure out what's the best treatment plan for each patient. But sometimes patients may not want their information in the big data circle. So it's really important that doctors are just super transparent with their patients on what information is going to be out there, what information they don't want out there, things like that. Twin studies is also another big concern because when there's testing done for something in one twin, it can unknowingly reveal something about the other twin without their consent. And the biggest one is just the implementation of precision medicine because there's currently a lack of evidence. Since it is such a recent discovery, sometimes doctors are having to make decisions just based on what they know best or what their gut tells them instead of having solid evidence to back that up. Going more into the challenges and controversies, of course, the cost effectiveness is very expensive. And a lot of people say that will just increase the gap between who can and can't receive healthcare. The big data, like I talked about earlier, precision medicine is just fueled by those large amounts of data. And that means leaks are possible and patient information they don't want out there could potentially get out there. And the last controversy is it exaggerated? Many critics say medicine can't truly be personalized, but I think if they continue following down the right path, it can be. So the future prospects. After companies start working through these ethical, developmental concerns, I believe the future looks so promising, especially if they start to have more of a combination of evidence-based medicine with precision medicine. Now, evidence-based medicine is based on a hierarchy, and the most important things are controlled clinical trials, meta-analysis, so it's just filled with a lot of reliable information. And when they partner that with precision medicine, so they're still valuing patients' values, their environment, lifestyle choices, genetics, but also having that reliable evidence to back it up, that looks like a very promising future for precision medicine. Additionally, AI can be really helpful in the future of precision medicine as it's helping to manage big data, analyze genetic sequences, and simulate clinical trials, which could never be done before. This image over here shows elements of precision medicine that people are working better to incorporate by 2030, which I hit on most of these, the big data, artificial intelligence, getting better with the privacy, trust part of it, really focusing on diversity and inclusion and making precision medicine accessible for everyone. This graph shows a projected market size of precision medicine in the US, and it just goes to show that the future of precision medicine is the future of medicine. You can kind of see down at the bottom where we're at right now, and it's expected to skyrocket by 2033. And I think if they start to work through these ethical concerns, focus more on evidence-based medicine, that will happen. In conclusion, precision medicine is biotechnology that provides treatments based on individuals, genetics, epigenetics, proteomics, environment, lifestyle choices. And I think it has a very bright future, especially once these ethical concerns are worked through and they start to combine precision medicine with evidence-based medicine, because that would allow personalized treatment that's actually backed by reliable research. Here are my works cited, my images cited.